Should pregnant women vape?
My name is Caitlin Notley. I'm a Professor of Addiction Sciences at the University of East Anglia, and I have a programme of research around smoking cessation and relapse prevention, particularly focused on vulnerable populations and interested in harm reduction approaches for smoking cessation.
My question for you is, should we be recommending vapes to pregnant smokers?
So we have to remember that smoking during pregnancy is one of the most damaging things that a woman can do to her own body and to the developing child within her. So quitting smoking, on the converse, is one of the most positive things that a woman could do to improve the health of her unborn baby and also her own health. Smoking during pregnancy is uniquely damaging to a growing fetus. We know that pregnant women who smoke are much more likely to give birth to a baby of very low birth weight, to suffer a miscarriage, or to have a baby that's born very prematurely, possibly then needing intensive care in a specialist neonatal intensive care unit. So anything we can do to support pregnant women to quit smoking is really positive. But we know that smoking tobacco is really addictive. It's very, very difficult for pregnant women to quit smoking, and particularly possibly difficult for pregnant women who, many of them know very well that smoking is dangerous and damaging, but they really struggle to quit. Now, we know that vaping or using an e-cigarette is the most effective way that people choose to quit smoking. Therefore, if we support pregnant women to vape as a way of quitting smoking, we will improve pregnancy and birth outcomes at population level.
You mentioned low birth weight. We hear about women who think actually low birth weight wouldn't be such a bad thing. It'd make for an easier birth. Like I was 9 pounds 2 ounces at birth. It might have been better if I was a bit more compact. So is low birth weight really a problem?
It is a very real problem. Having a baby born at less than optimal birth weight has very many health implications for the infant, who's more likely to suffer breathing difficulties, suffer infections, require admission to hospital and potentially specialist intensive care, which is incredibly stressful and also incredibly expensive for the NHS. No mum wants her baby to go through that, and no family wants to go through that very, very stressful experience. The best thing for a baby is to be born at full term, fully developed, and of a healthy birth weight. I understand your mum's position. Perhaps she didn't want to have a too large a baby, but having a baby born very low birth weight is incredibly damaging to the baby and a difficult situation for a family to deal with.
Yeah, I was number 5 anyway, Caitlin. She probably wasn't even noticed. She probably just thought she'd had a big sneeze or something. But when we were doing the RCP report on smoking and pregnancy, I was genuinely shocked at the thousands of miscarriages every year that are attributable to smoking. I think it was something like 5,000, as well as low birth weight, and again that risk of sudden infant death. We have all these huge risks for smoking. What evidence is there for risk from vaping so far?
Well, because we know that smoking during pregnancy and as you've pointed out, also in the postpartum period when babies are very small and vulnerable, because we know that smoking is so dangerous, then by comparison, switching to using nicotine in a less harmful way, so through using e-cigarettes, we know is far less harmful than continuing to smoke. We don't have any evidence so far at all of harms caused to infants from second-hand exposure to vape. And as you know, we do have very clear evidence of the harms to infants from second-hand exposure to tobacco smoking. So there's kind of a number of issues here. There's not only supporting pregnant women to quit smoking, but also supporting them to stay smoke free in the postpartum period, to avoid relapsing back to tobacco smoking. So maintaining that smoke free home, really important for infants. And if vaping is a way that women manage to stay smoke free, then that's a really, really positive health outcome for her and her family.
Yes, but most pregnant smokers who quit do go back to smoking. Isn't that true with e-cigarettes as well?
Well, I think unfortunately one of the issues around pregnancy and vaping is that there is a stigma attached to it. I think many pregnant women don't want to be seen using an e-cigarette or vaping through fear of being judged, and so perhaps would hide that or attempt to move away from vaping. And that, of course, if they have a nicotine addiction, potentially leaves them vulnerable to returning to tobacco smoking. Yes, absolutely. We know for pregnant women who manage to quit smoking, relapse risk immediately postpartum is incredibly high. In fact, up to 3/4 of women who quit smoking during pregnancy will relapse back to smoking in the 12 months after they've had their baby. So vaping potentially offers an alternative, not only to help people quit smoking, but also to help them stay smoke free. If we can encourage women to go back to a less harmful alternative, if they're having cravings for nicotine, such as using an e-cigarette, there's a really important potential role then, I think, for e-cigarettes for a relapse prevention option.
Yes, but nicotine is harmful to the fetus, isn't it?
Well, actually, we know from really solid evidence through randomized controlled trials that nicotine doesn't appear to have any adverse impacts on infants. So, a really important study that was carried out in the UK recruited over 1,000 pregnant women, gave them nicotine replacement therapy. So, used nicotine during pregnancy, and followed up infants up to the age of 2 years. And they actually found no increase in adverse events or infant deaths for those mums who had used nicotine throughout pregnancy at all. So suggests that nicotine is safe for use during pregnancy. And indeed, in the UK, midwives are able to support pregnant women and prescribe nicotine use during pregnancy because it's so much less harmful than continuing to smoke tobacco. So
That's
by
right.
that rationale,
Yeah.
nicotine use through vaping is also a much safer alternative than tobacco smoking. And in fact, we had a major research study published in the UK last year where pregnant women were recruited and given either nicotine replacement therapy or a nicotine-containing e-cigarette. What that study found is that women who used the nicotine-containing e-cigarette were more than twice as likely to quit smoking than women who used prescribed nicotine replacement therapy. So the nicotine e-cigarette was more effective at supporting them to quit smoking, and there were no significant differences at all in adverse outcomes for those pregnancies.
So that's interesting. Is that because e-cigarettes were just giving them more nicotine, or they were using their e-cigarettes more than they might use their gum and patches?
That's a real possibility. What we find in pregnancy studies is that women prescribed nicotine replacement therapies often don't adhere to the treatment they're prescribed. We know the best thing for smoking cessation is to use enough nicotine, so you're not experiencing nicotine withdrawal and therefore not at risk of smoking relapse. But pregnant women tend to not want to use too much nicotine. Perhaps they're worried about the effect of nicotine on their baby, so they underdose and therefore they are at risk of smoking relapse. But actually, with an e-cigarette, perhaps women were able to use them, as and when they needed to, in a kind of ad lib way, and that we think may have helped them to stay smoke free. And in fact, what was found in that study is that many of the women in the nicotine replacement therapy group started to use an e-cigarette too. So it seems like this is a choice and something that people perhaps prefer as an alternative to tobacco smoking.
And a choice that you would support.
I would certainly much rather see a pregnant women vaping than smoking a tobacco cigarette, yes.
Yeah, that's fair enough. There isn't much evidence from the randomized control trials that nicotine is harmful to the fetus. So nicotine replacement therapy, we have trials among pregnant women which show very little, well, no evidence of, no greater evidence of harm, you say. So nicotine isn't the problem, but maybe one of the problems is that either because being pregnant, they're metabolizing the nicotine more rapidly, or being pregnant, they're taking care, they're trying to protect their baby by having less nicotine, exposing less nicotine. Women are kind of underdosing themselves and are less likely to quit successfully. And your advice would be to make sure that you get enough nicotine during pregnancy and afterwards to quit and stay quit, because that's going to be the best thing for the mother and the baby.
Yeah.
Okay.
That's absolutely right.
All right, Caitlin, you know the form. It's true or false. Pregnant women should not vape. True or false?
If a pregnant woman is a smoker, she should absolutely vape rather than smoke.
Professor Caitlin Lawley, thank you very much.